exercise series for those of you who might be struggling with low back pain, SI joint pain, or any diagnosis that might come from the inability of the glutes and adductors and all of those inner working muscles to really create stability through this lumbopelvic joint. So that might entail greater trochanteric bursitis and pain in the lateral hip. It may be more of a hamstring tendonitis type of thing. It could be just pain across the low back. It could be pain down and through the hips. It could be groin pain. So many things can come from instability within the hips and pelvis. So give this series a try, break it up as you need to. There's a lot of exercises within. So we're gonna lift into a side plank and add a clamshell with it. So great stability here and then opening in the hips. So key points here is the elbow is gonna be directly under the shoulder. As you bring your hips up, we're gonna stay on the knees for this one. Make sure that top shoulder to bottom shoulder to elbow are all staying relatively lined up. You may keep one hand kind of on your tummy, which can also create some great awareness for what your abs are doing during this activity as well. So we're gonna come up into this side plank. Bottom leg is gonna be anchored, and top leg is just raising, heels staying together, and we're just coming up to the point where it can be controlled. If you start rocking backward, then you've gone too far. So nice tight core, a lot of oblique work happening here, and then we're just opening and closing. Nice slow, like a 2-second hold at the top is plenty. And you should feel work happening in both outer glute regions. This one as you get to the top range, and this one through full range. Try 10, maybe 2 sets, 10 to 12. All right, this next one. So number 2 is a bear plank. So we're gonna come so that shoulders are directly over wrists, knees are right under the hips, and toes are active and supportive. Belly button is pulled up and into spine, so we're not sagging in through the back this way. We're gonna bring the knees off the ground about 3 or 4 inches and stabilize there. Once you feel comfortable in this position, you're gonna take your knees and press them away from one another. It's just a few inches in each direction. If you're not getting too much in the glutes, we might bring our feet so that they're touching. Knees are gonna stay that same hip width distance apart. Flat back, belly in, and push. Try it in both angles as the muscle use is a little bit different in each position. So this next one we're looking at hip flexor strengthening. So really working the front of the hip in efforts to give mobility and stability to the back of the hip. So you want to use a light band or probably the largest band for this one. Bringing your hips and knees up to this 90-90 position. Belly's pulled in, but you're most notably working in the hip flexors. So what we're gonna do is we're working the leg that's staying. So with one working leg, you're gonna gently press out, stabilizing here, and then you'll come back in. Press out and hold, and draw it back in. Try not to let the stability leg go anywhere. And you, as far as height of the foot that you're dropping, right, you're gonna determine that based on what your low back does. So if I kick lower, my low back sneaks off the floor and my abs protrude, so that's not a good place for me. So for me, I'm keeping my leg relatively high and getting the same amount of power and work out of that psoas. Again, shoot for about 10, 2 sets if you can. Unless the back starts bothering you, keep it all tight and flat. If it becomes problematic, you may just try it without the resistance band. Now we'll reverse the work. So you're gonna lie flat, belly's gonna be tight. Again, trying to relax the shoulders down onto the floor. You're gonna choose a leg to stabilize and keep down against the floor while the other leg marches up and relax down. You're gonna march it up, trying to get as close to that 90 degree as you can. without passing it, or then it becomes more of an ab activity rather than hip flexor. Again, same thing, 10 to 12. If this is bothersome for the back, you might get a prop, something small to tuck under the feet. So just giving the feet a little bit of elevation as to allow the back to relax down a little bit more, but the exercise looks the same. Stability here. And you can add as much as you need underneath the feet to be able to achieve this motion. Now we're going to come back to the side plank and add some rotation in this time. So it's same thing, we're stacking the shoulder over the elbow and top shoulder over the bottom. Hips are elevated up, glutes are squeezing, abs are squeezing. And what we're gonna do now is take an arm and you're just gonna rotate down and around so that your forearms come to line up with one another here. And then you're gonna rotate and open back the other way. You're just rotating down, squeezing abs in. You should feel, if you're on your right arm, you should feel the right obliques working. Okay, 10 to 12 again on each side. And then to progress that, you'll come back into that same plank and then just take the top leg out straight. All the same cues, belly's in, obliques are tight, glutes are tight. You're just gonna bring the toe down toward the floor and then raise it up. Only as far as it'll go, not so far that you have to start dipping down to the floor and straight up. Try not to deviate forward or backward. Shoot for 10 again. And if all of that felt easy, you can certainly bring this up into a full straight plank so that you're resting on the feet rather than on the knees, and do that same rotation and extension. Again, shoot for 10. Next piece is bringing the leg up to hip level, and then you're gently gonna kick forward and backward without letting the spine and body go anywhere. Again, shoot.
So now let's get these inner thighs directly involved, because these are super, super important for pelvic stability from the groin level out. So there are a couple different ways that we can get to this one. If you have a ball, it's a great option. So progression 1 is going to be bringing the ball closer to the knee. The further out to the foot you get, the more difficult and challenging this will become. So we're going to bring it in so that it's supporting the knee. You're going to kind of keep this leg tucked out of the way because you're going to use this leg to help lift you upward. So you're going to situate yourself in that nice side plank position again, shoulder over the elbow, belly is pulled in, and then we're just going to lift straight up. Trying to initiate this motion, thinking about this muscle that comes from the middle part of the knee all the way up to groin line. So toes are pointing forward, we're gonna lift straight up, squeeze and hold, and then lower back down, slow and controlled, just the way that you got there. As you feel comfortable with that and you feel like you've got it pretty well stabilized, you can scoop the ball out a bit and do the same thing. You'll notice the strain, the increased pull in through the groin. And then one more progression for this with the ball is actually relatively tough, but you can take the legs out straight so that the bottom ankle is situated direct and lined up. So you're giving the ball a good squeeze to start with, and then you're raising to the top, holding that active squeeze, and then lower back down. Makes a great stability component because the ball is kind of wiggling and trying to get away from you a bit. So squeeze down, hold and lift, and lower nice and slow.
So if a ball isn't an option, I just have a few yoga blocks stacked here. I understand that most of us probably don't have 3 yoga blocks lying around. So you might look for a lower chair or a small ottoman, something that's not going to take you too far out of neutral, and maybe something about mid-height to maybe the full size height of your ball. So what we're going to do here
the same gig with starting with your support surface right around the inner thigh, medial knee, unless that's just too painful, because it can be pretty tender depending on what kind of object you use. So we're gonna come into that same thing. Start with that same progression, lifting up and squeezing, initiating the motion with the inner thigh. And get a few there. And if you're feeling strong through the core and back and nice and stable in this position, you're gonna come up, and then we can try to bring this bottom leg up to meet the top one and lower it nice and slow. So you're gonna bring it up and lower down. Bring it up and lower down. If all that feels good and there's not too much pull on the groin, you can come out a little bit further and do the same thing. Give yourself a little support first, and then you're gonna lift and pull that bottom leg up. All right, give those a try. So now if we can get a light resistance band tied up high, kind of in line with hand and shoulder. We're gonna take leg closest to the wall for our support leg while we're kneeling on the other. So number one piece of this is keeping the pelvis tucked under without letting your back splay. Right, so we're gonna keep all of this nice and tight. Abs are tight again. You're letting the band pull you up and away. So your eyes are coming with, you're rotating to look, and then we're pulling straight down toward the other side. Rotate away and pull down. Keep that hip and pelvis in check. Leg closest to the wall is gonna come up. You're reaching kind of at an angle away from the wall. Rotate and bring it down. Keep that pelvis in check. So now we'll give those arms a break, and we're gonna work into that bridge again. So we're gonna push the hips up, and to work on this progression here, what we're gonna work to do is keeping the hips level in this top position and taking a leg and pressing it out and forward. This is the ultimate goal. We can start here and just doing a light march, nice and slow. If this is still painful or still causes any sort of pinching or binding in the low back or SI joint, you might take something like a yoga block and give yourself a little bit of support, something just to kind of touch down on. You don't want to rest on it and just march away, right? You want to stay active in your glutes and just give your body maybe like 20, 30 to 40% of support in this region. Glutes are tight, and you're gonna do the same thing. This also gives you a nice awareness, even if you're not resting on it, that if I were to be dropping my hip as I went, that block would be telling me that was happening. So just nice and easy. Glutes and hamstrings should both be firing and working here. Increased difficulty would be taking the hands away from the surface and continuing that stability march. So now to get directly into the abs, if you have something a little bit heavier that can kind of lock your weight down up top, it just increases the efficacy of the exercise. So with the weight up top, you're just trying to bring your elbows so that they're kind of close to the ears, and then we're bringing the legs up so that hips and knees are both at 90 degrees, creating this nice tabletop position. Abs are pulled in. So what we're working to do here is move the legs while the back and abs stay stable. So we don't want to drop and let the lumbar extend up off its surface. So we're locking it all down, thinking about not only scooping down and in, but also wrapping the muscles. So not only bracing downward, but also trying to almost squeeze and shrink around your rib cage and try to get a sense for that use of the musculature. And then we're just going to drop and tap a toe and then drive it back up. Back is staying flat against the floor. If you're feeling a lot of pressure in the mid-back with this, you might just need to squeeze the elbows a little closer to one another to really get the large muscle groups working in the mid-back to give you a little bit more stability there. And last piece to this puzzle is we're going to come back into this 4-point position and do a stabilization
stabilizing exercise for some of the smaller musculature that resides between the vertebral bodies. So rather than doing this long extension bird dog type of exercise, what we're going to do is really scoop the belly in and then just lift a knee about 2 inches and lift the opposite hand about that same 2 or 3 inches, and then rest it back down and then switch. You'll probably find that it feels pretty easy and it shouldn't feel like a huge challenge, but what you should notice is that likely one side feels slightly easier than the other. So we're working to keep the hips stable, the shoulders stable, and to not rock away as you're lifting your extremities. About a 3-second hold at the top of each one.